get my shoes and out the door. 5, I'm alive. 6, 7, 8, feeling great.
Hello, BYWG Podcast Tribe. This is Dr. Noah. For the month of September, we have an incredible book of the month and product of the month, or should I say products of the month, to share with you all. As a reminder, all the links for the book and product of the month will be listed in the show notes on iTunes, in our weekly newsletter, and on our website at www.beyondyourwildestgenes.com at the Listen Now tab. Our book of the month is Ketotarian, the mostly plant-based plan to burn fat, boost your energy, crush your cravings, and calm inflammation, by Dr. Will Cole. Dr. Cole has been on the podcast twice, and you can find his interviews at www.beyondyourwildestgenes.com in the archives at the Listen Now tab. The product of the month is the entire line of Primal Kitchen condiments, foods, and nutritional products. All Primal Kitchen ingredients are selected according to the strictest standards of taste, natural healthfulness, and phytonutrient potency. Some of my personal favorites are the chipotle mayonnaise and the lemon turmeric salad dressing. Enjoy free shipping on all orders of $50 or more and 10% off your order using our special code for our audience, BYWG. Enjoy the upcoming podcast.
Hello and welcome back to Beyond Your Wildest Genes podcast. My name is Dr. Noah DeCoyer and I'm your co-host. Today our guest is Amy Medling from PCOS Diva. Amy is a certified health coach who specializes in working with women with Polycystic Ovary Syndrome, or PCOS. She's the founder of PCOS Diva and has developed a proven protocol of diet and lifestyle programs that offer women tools to help gain control of their PCOS and regain their fertility, femininity, health, and happiness. She lives in Nashua, I hope I'm saying that right, New Hampshire, with her husband and 3 children. You can find more information at www.pcosdiva.com. How are you today, Amy?
Oh, I'm doing really well. Happy to be here.
Great to hear your voice. So, first questions first, when we interview someone for the first time, how did you create the PCOS, this whole genre for you? Where did that come about?
Yeah, so it actually was very organic. I never expected to be the founder of a website to help women with PCOS thrive. I actually was not even diagnosed with PCOS until I was around age 31, after wrestling, that I now know with many of the symptoms since about age 14. But I had my own PCOS struggle. I often hear from women with PCOS who are frustrated and have lost all hope because the only advice their doctors offer is to lose weight, take a pill, and live with their symptoms. And for much of my life, I was one of these women. But after, quite a long journey, I came to a place where I realized that I had to take control of my health, and nobody could do it for me. I had spent years going to doctor, being prescribed many different pharmaceutical drugs that actually made me feel worse and more miserable than I was feeling. And after reading lots of books and tons of hours of research and trial and error, I kind of developed a protocol that helped me to feel better. I changed my diet, my lifestyle, and most importantly, my mindset. I started taking care of myself, and my husband kind of noticed this shift in me. And one day, I write about it in my book, but he sort of declared me this diva. And at first I was offended until I realized that in order to be my best and to give my best to my family, I did have to be a diva. And it was when my reproductive endocrinologist started kind of referring patients that also couldn't tolerate pharmaceuticals to manage PCOS, and I started sharing what I was learning. I realized that my Diva protocol could really help others, and that's what kind of launched my website, PCOS Diva, just really sharing what I was learning to help other women with PCOS who are struggling.
Okay. So, Amy, we've done about 160, 170 plus podcasts, and I'm quite certain we've never had anybody on discussing PCOS. So how about a little bit of PCOS 101 for our audience?
Sure. Well, that's interesting. It's the numbers of women who are affected with PCOS. It used to be 1 in 10, and that's what I had referenced in my book. But recently, research is indicating that as many as 1 in 5 women are affected by PCOS symptoms. And PCOS, again, stands for Polycystic Ovarian Syndrome. And it's a syndrome, so it's not specifically a disease, but an array of symptoms. And the symptoms, I believe, are driven by 3 factors. So the first being hormonal imbalance. And a lot of women with PCOS have excess androgens or male hormones like testosterone. And they tend to have low progesterone and estrogen dominance. So it's sort of this hormonal imbalance is a driving factor, as well as insulin resistance. Most women with PCOS, whether they have the thin phenotype or the classic phenotype, which is more kind of like the centralized obesity and difficult losing weight, is driven by insulin resistance, and it's a major factor of PCOS, as well as inflammation. So those are kind of like the 3 driving factors, and those factors can lead to a myriad of symptoms such as hair loss, hair growth or hirsutism, where hair kind of where you don't want it, acne, especially jawline acne, issues of insulin resistance like skin tags and weight gain and hypoglycemia. And women with PCOS are also at greater risk of thyroid conditions, especially hypothyroidism, mood-related disorders such as anxiety and depression, as well as eating disorders. And the list can go on and on. But the really scary statistic that I think of is that between 50 to 70% of women with PCOS do not know they have it. And over time, PCOS can lead to chronic health conditions and life-threatening health conditions like cardiovascular disease and diabetes, as well as endometrial cancer, because many women with PCOS don't ovulate and have irregular menstrual cycles, so they're not shedding that uterine lining, which can lead to cancer.
Now, you mentioned estrogen dominance and androgens, but is there a cause of it? Do they know what's really causing? What's the underlying reason why so many women are getting this?
You know what? They still don't have a definitive answer, and it's interesting that there's, I kind of mentioned like the classic phenotype of PCOS and the thin phenotype. There's different theories of thought that there's, many different types of PCOS. And, I kind of have like what you would describe as this thin phenotype. I never really struggled with weight issues, which, at one point I might have been 50 pounds heavier when I was really dealing with PCOS, but many women are much, much heavier than that. But it seems that thin phenotype is driven by adrenals, and it's kind of like this adrenal androgen excess that is driving the PCOS, but that's not the same for a lot of women. And so sometimes it's like the insulin resistance that's the big driving factor. There's some thought that there's a genetic component to PCOS as well. But not every woman has, a relative that has PCOS. And then there's also this other kind of this emerging thought that many women get sort of this post-pill form of PCOS, so coming off of the pill, they seem to show signs and symptoms of PCOS, but it might just be temporary as their body adjusts to coming off the pill. So there's really no hard and fast reason why women have PCOS right now.
That has to make it much more complicated to diagnose it, treat it, and manage it. It seems to me, anyway.
Oh, absolutely. Yeah, I mean, I think that's why we have such a difficult time, getting women getting the diagnosis that they need. Right now, the kind of the standard diagnostic criteria is they call it the Rotterdam Criteria. So basically, if you exhibit 2 out of the 3 following, you'll be diagnosed with PCOS, and then you'll want to kind of get a series of labs and to so your doctor can monitor your condition. But so those 3 criteria are the excess androgens, the elevated testosterone levels, and then number 2 would be irregular cycles and ovulatory cycles, and then number 3 would be and we didn't talk about this, kind of that polycystic ovaries. So on an ultrasound, you would see it's kind of this string of pearl look around your ovaries, all these small underdeveloped follicles. But the tricky thing is that 30% of women with PCOS can have PCOS without polycystic ovaries. And then there's some women that have polycystic ovaries but don't have PCOS. So there's a great deal of confusion.
It seems like it. So amongst everything we just discussed, a woman goes to your site or you coach a practitioner. What is the first step to treating PCOS?
Well, I believe that lifestyle modification is kind of first-line therapy for PCOS. And there's so much and that's what I write about in my book, Healing PCOS. There's so much that's within your control. I know a lot of women with PCOS, and I was one of these women, they felt sick and tired of feeling sick and tired and they feel way too young to feel so old, and they feel like their body is betraying them and that they're just sort of out of control, or their body's just out of control. But there's so much that you can do that's within your control. You can, really change your diet so that you're eating an anti-inflammatory diet to kind of combat that systemic low-grade inflammation that's going on. So to me, that's kind of the first thing that you can do, eating lots of plant food. And I'm not saying that you need to be a vegan or vegetarian. I think that that's somewhat very difficult to maintain that type of lifestyle and successfully manage your PCOS. I do think that most women with PCOS need to have some clean animal protein, organic chicken, grass-fed beef, organic eggs, fish, but lots of vegetables, and some low glycemic fruits and healthy fats. Women with PCOS need, lots of healthy fat, omega-3s, and, it's just really important, and high fiber. So just making those changes can make a tremendous difference in the way that you feel. You want to be managing your blood sugar, and increasing insulin sensitivity. You can do that with, some supplements. Can be really helpful for PCOS, like inositols, myo-inositol, D-chiroinositol, omega-3s, as I mentioned. You want to optimize vitamins. I think a lot of women with PCOS are overfed and undernourished, so you want to make sure that you're getting, adequate vitamin D and B vitamins, methylated Bs, and magnesium. And then exercise. That's so important for women with PCOS to build strength and muscle to help with that blood sugar metabolism, and also to decrease stress, as I mentioned, mood-related disorders is a big issue, and women with PCOS tend to have higher levels of cortisol. So exercise is great for stress reduction as well. And then I talk a lot in my book about mindset and realizing, that you don't have to be a victim of PCOS, and there is so much within your control. So those sort of are, in my mind, the first steps if you've been diagnosed.
It's amazing to me the more and more patients I take care of, and the more and more information I read, and the research I do, and the podcasts I do. It always comes back to the same thing, regardless of what we're talking about, whether it's PCOS or arthritis or whatever. It's always getting back to a lifestyle that supports a healthy human every single time.
Yeah, I know it. And I think, PCOS, it's been suggested that there is, some like autoimmune component. And, you look at so many of the chronic, issues the health issues that people are facing. And it is, has an autoimmune component. And women with PCOS are at elevated risk of other autoimmune conditions like Hashimoto's, and so, all of those protocols are somewhat similar. And I think that you're absolutely right. Just, making healthy choices through your day can make such a positive impact on your health, no matter, what you're dealing with.
Now, I'm a chiropractor, and I see quite a bit of women, a higher percentage of women. I take care of a lot of pregnant ladies. But my experience with PCOS is the young female that's having trouble getting pregnant, and they can't find out why, and then they get diagnosed with PCOS, and then they just then they go down to that rabbit hole. What do you say to young women, or not even young women who are trying to get pregnant, who are having difficulty because of their PCOS diagnosis or subsequent PCOS diagnosis?
Yeah, thanks for bringing that up. I failed to mention that PCOS is the leading cause of female infertility. So you're right. There's a lot of women find out that they have PCOS when they're trying to get pregnant, and that was certainly what happened with me. But I want women to know that there's so much hope. And I was told at age 18 that it would be very difficult for me to have children. The doctor literally told me they would have to jump through hoops to get me pregnant one day. And I hear that from a lot of women with PCOS. They're told that it will be difficult to get pregnant, or they won't get pregnant. And I want women to know that is really doesn't have to be the case. And most women with PCOS can and do get pregnant with the right treatment. And, I think chiropractic care is really important. It's something that I do. I mean, I go to a chiropractor every other week. For a lot of women, I think that it can really help with their cycles. But I want women to know that when you have PCOS, your clock really isn't ticking at the same rate. So if you're like in your early 30s and you're not pregnant yet, and you think, oh my gosh, my clock is ticking. Interestingly, women with PCOS tend to remain fertile longer, and they reach menopause later in life. And it seems that their hormones become kind of more balanced, especially like the androgens. When they were high in their 20s and early 30s, they start to decline in their late 30s and early 40s. And so their hormones kind of become more balanced, and you will see a lot of women kind of get more regular menstrual cycles and start ovulating when they weren't ovulating regularly in their 20s and early 30s, and become pregnant. So to just maintain, the healthy anti-inflammatory diet and exercise and supplements, and inositol are great for egg quality and fertility, and just have hope, and it is very much possible to have a healthy pregnancy.
I couldn't agree more. Now, you started, we talked a little bit prior, you started the PCOS Diva, and it's the country's largest online community for women with PCOS. So, what does it mean to be a PCOS Diva?
Oh, yeah. So I would love to just read like a little excerpt from my book where I describe what a PCOS Diva is. Okay. A PCOS Diva is a woman with hope. She has taken charge of her health and happiness and takes steps every day to enhance both. She chooses to thrive with PCOS and is empowered by the knowledge she gathers as she educates herself about PCOS. As a result of her regimen, she's able to give her best to herself and others and be an example of the power of self-care. She's capable of advocating for herself and surrounds herself with the supportive healthcare team and community of friends and family she deserves. A PCOS Diva looks beyond the physical support required to manage symptoms and works to heal and enhance her whole person, mind, body, and spirit.
Amen.
And I do think, I talk about a supportive healthcare team. And, I think there's so many modalities that help PCOS, like chiropractic and acupuncture. I'm a health coach, and helping women make healthy choices around their lifestyle and working with somebody that can help you do that, whether it's a health coach or a nutritionist. There's so many more people that can help you, besides just like your primary care physician.
Yeah, you mentioned acupuncture and chiropractic, and even lifestyle and stress and cortisol.
Mm-hmm.
I look at it, anything that takes you out of that sympathetic state, puts you into a parasympathetic state, relaxes you, decreases stress, decreases cortisol. That helps everything and anything when you're dealing with any kind of illness.
Oh, yeah. And I think people underestimate the importance of stress reduction, and what goes along with that too is sleep. And I'm sure that you probably covered this in your podcast, but just the importance of sleep. And I just think that so many of us just are not getting enough of it, and it makes such a difference in your health when you're getting good and adequate sleep. And, something that I'm just going to mention for those listening that think they might have PCOS, many, many women with PCOS have sleep apnea and don't even know it. So if you're struggling with sleep, I really highly suggest, working with, a sleep specialist to kind of get to the root of your sleep issues. And you might, have sleep apnea, and treating that can make a tremendous difference in the way that you feel.
I'm glad you brought up sleep, because I was going to, and it was the last piece of the lifestyle that you hadn't talked about, and mm-hmm. I'm glad you brought that up. And sleep is kind of the linchpin for everything, isn't it, Amy? I mean, that's the way I look at it.
I know. Oh, I know. And gosh, and I'm sure you can remember those days when you had little ones and you were so sleep deprived. It's so hard to operate well when you don't have enough sleep.
Oh, I still have relatively little ones, 13 and 8-year-old, and I haven't slept well. I haven't slept well since they were born, so I'm working on it.
Yeah.
Now you have a book that's I believe it's already released. I believe we'll have the links to pick it up, the Amazon link. Healing PCOS, a 21-day plan for reclaiming your health and life with polycystic ovary or ovarian syndrome. We talked about it, but tell us a little bit about this book.
Yeah, and I just want to kind of explain why I called it Healing PCOS. If somebody tells you that there is a cure for PCOS, they're really kind of selling you something that's that's not true, because right now there is no cure, unfortunately, but I believe it can be very well managed. And I think that there is, although you can never truly be quote unquote healed, there is like this continuum of healing. And that's why I called the book Healing PCOS. And I give you this 21-day plan that combines, what we've been talking about, diet and exercise, mindset, a sleep hygiene program, to really help you get the sleep that you need. And I provide a supplement regimen and put that all together for women to follow, so that it really jumpstarts a healthy lifestyle and helps you to thrive with PCOS. And I have dedicated a whole chapter to, thinking like a diva. And I kind of tell you, before you can move forward in the book, please read that chapter. You can't eat and move like a diva until you really think like one, and move away from kind of like that victim lack mentality to a place of empowerment and, what I consider sort of an abundant mindset.
I'm backtracking a little bit, but it just popped in my mind. But I have to ask this question: are there any foods that have absolutely been shown to aggravate PCOS and the symptoms of PCOS? Like total no go, like don't go near that food, or a high percentage?
Yeah, well, so because PCOS is a syndrome, I think it really affects every woman in a different way. And so I never say that there should be sort of like this one size fits all approach to diet. That's why I kind of use this umbrella as an anti-inflammatory diet. And it really depends on what inflames you, right? So I know for me and for a lot of women that I work with, gluten and dairy can be very inflammatory. I do think that processed soy can be very hormonally disruptive, as well as dairy can be hormonally disruptive. But then I do think that it's important to kind of figure out what your food sensitivities are. And a couple of years ago, I realized that I was highly sensitive to eggs. It wasn't until I kind of did an elimination diet and then put eggs back in that, they were causing me, a lot of, issues. And for me, it was like a symptom of exhaustion. I would feel very exhausted after I ate eggs. Like I needed to take a nap, and it was, causing inflammation. So I think people need to experiment with their diet and, go on an elimination program and then add things back in. I know that the ketogenic diet is really popular right now, and a lot of women with PCOS seem to do well on it in the short term. I think the other caveat about diet and food, it has to be a sustainable way of living. And, because you're going to be dealing with PCOS over the course of a lifetime, you need to be able to sustain a healthy diet over the course of a lifetime as well. So, looking at it as a lifestyle rather than, the traditional quote unquote, I'm going on a diet, is a really important mindset as well.
Yeah, well said. Now I have two questions. One final question, essentially, and it's a question I end every podcast with, and I've asked it probably the last 60 interviews. From waking to sleep, do you have a rhythm?
Well, you know what? I think on the days in the time periods of my life where I'm thriving, yes, I absolutely have a rhythm. And when I am struggling, it's really because I've kind of neglected that rhythm. So yeah, when I'm thriving, I definitely do have a rhythm.
And what is that rhythm?
Well, I wake up early before my kids wake up so that I have some time for me. And that's, I think part of that self-care and being a diva. And I always, even when I'm not on a rhythm, I start my day off with some warm water and lemon. I know a lot of people do that, but for me, it just sort of sets the stage, for making healthy choices for like what I put in my mouth rather than a cup of coffee. And, I have that time for myself. I make my bed and tidy up my room. I mean, there are a lot of people talk about that, making your bed sort of, it's like that. If I don't get anything done during the day, at least I did that, and I can go to bed with, a room that's nice, that feels calm, and that's part of my sleep hygiene. And then making sure that I do some type of movement every day is part of that routine. And making sure that I have food on hand so that I can prepare healthy meals, whether they're simple or elaborate. I mean, that would be part of a rhythm for me. And then at nighttime, always ending my day with some type of gratitude, and thanking, God for the good stuff that happened to me during the day, before I, close my eyes and call it a night. Those are sort of the elements of my rhythm.
Thank you for answering that question. I hope it wasn't too intrusive. I find that question is very helpful for people.
Oh yeah, and I think that's something that I'm always intrigued at. I follow, I'm sure as you do, like a lot of interesting people on social media, and when I love like listening to podcasts where they talk about like what their routine is, because there are people that inspire me, and I love to hear what their rhythm of their day is too. So love that question.
Any last words for our audience?
Well, I just want to leave women who are listening, that they might have resonated with what we talked about today in terms of like some symptoms that they're experiencing, and they might have PCOS. I want people to know that there is so much hope, and but to be a diva, and make sure that you advocate to get the care that you need, and don't underestimate the power of lifestyle modification to be able to thrive with PCOS or any chronic health condition.
No, well said. My name is Dr. Noah DeCoyer, your co-host, and you are listening to the Beyond Your Wildest Genes podcast. If you like what you've heard today, please share this with your friends and family and encourage them to subscribe on iTunes or most recently Spotify. The links to the book will be in the notes and on our website at the Listen Now tab. Thank you, and as my oldest son Hayden says, be awesome and never unawesome.
1, 2, 3, 4, get my shoes and out the door. 5, I'm alive. 6, 7, 8, feeling